Myth number 5. 45 million Americans do not have health care now. Many have dissected the number of 45 million not having access. Some are young adults and choose not to pay for insurance. Some are between jobs and look to employers for insurance. Some are illegal aliens, and some are genuinely not insured despite their desire to be insured. However, virtually all these people have access to health care via clinics, hospitals, or emergency rooms. Laws in place now require that. Americans have health care now. Cost of the healthcare system is the concern, not health care itself. Myth number 6. The tort system can be ignored in the issue of health care costs. The President wants to get to best practices and eliminate all the unnecessary tests and procedures, sounds like rationing already, that are done merely so doctors and healthcare professionals can ensure their profits. The risk of lawsuits in many cases drives the level and number of tests done. If a doctor misses something that another test could possibly have found, the doctor, hospital, nurses, insurance company, and anyone nearby can count on being sued. Likely the one area that could reduce healthcare costs would be to rein in the number of lawsuits. However, the one area off the table for consideration is tort reform. It would affect too powerful of a lobby. Certainly, it would not be proper to eliminate the ability to sue when harmed, but taking the significant cost factor off the table is wrong. Myth number 7. This program of government health care will be a great thing for the country and individual people. If that were true, wouldn't everyone want to be a part of it? Of course they would. Why then do we hear already that senators and representatives won't be part of it? Why do we already hear that labor unions won't be a part of it? Perhaps those most deeply involved in creating it don't really believe it is so great for themselves, nor for powerful constituencies. Obviously, the plan is not so great when those writing it plan to exempt themselves. I fully expect if the government does take over the healthcare system, my life will be shortened from what it would be otherwise. Myth number 8. Forcing companies to pay for insurance or be fined will help. Somehow, we always get to the evil companies that don't care about people. Why is it most employees believe their own company is founded for good purposes and operates, as the individual employees do, with good practices? After all, the actions of a company are just the sum total of the actions of all its employees. If the company is good, the employees must be good. If the company is evil, that would imply the employees in total are evil. Having someone else pay for your needs sounds good, but always raises the cost. When someone pays for themselves, they have a direct incentive to lower cost. After all, now we're talking about our own money. But now the government will pay and tax companies more for this. Reality is that the fines are just another cost per employee and it takes money away from our paychecks. On the surface, the employer pays, but in actuality, they're paying for this for the employee, reduces the take-home pay of the employee. As healthcare costs go up, the fines will go up, and our paychecks will be reduced from what they could have been. But wait, now we'll have healthcare. Oops, we already do.